elbow is a specialized hinge joint that allows flexion and extension. It is made up of the ulna, radius, and humerus bones. The head of the radius articulates with the capitulum of the humerus. The trochlear notch of the ulna articulates with the trochlea of the humerus. The olecranon process of the ulna fits into the olecranon fossa of the humerus. The triceps brachii extends the forearm, and the biceps brachii and brachialis flex the forearm. The extensor carpi radialis brevis is the muscle usually involved in tennis elbow. It inserts on the lateral epicondyle of the humerus.
Boy, that sure was a great match. My elbow really hurts though.
Why has it been hurting?
I'm not really sure. It's really stiff when I hold things and in the morning. It even radiates all the way down my forearm.
Do you know what it could be?
No, not a clue.
It sounds like tennis elbow. You should probably see a doctor before it gets worse.
Hello, Jesse, I'm Dr. Fegley. What can I do for you today?
I just came in because I've been having a lot of pain in my elbow, and it's been getting really bad and swelling, and it's even radiating down my arm at some points.
Okay, does it burn at all?
It does. It burns really bad.
Okay, do you play any sports?
Tennis.
Okay, that could be tennis elbow. I'm going to do 2 tests quick. Can you stand up for me?
Sure.
Alright. I'm going to straighten out your fingers. I'm going to put resistance against it. Try to push your hand back.
That's all I got.
Does that hurt a lot?
Yeah, it did.
Okay, then shake my hand and try to give me a firm grip. Okay, you can sit down. It looks like you do have tennis elbow. And that is a painful condition that is caused by the overuse of the elbow. It is an inflammation of the tendons that join the muscles on the outside of the elbow, which is why you're having pain there. And this is caused by the repetitive motions that you make when you play tennis, for instance. So what you're going to have to do is give your arm proper rest by not playing tennis for several weeks, alright?
Alright.
And you can also take Motrin or aspirin to reduce the swelling and the pain.
Okay.
And if your pain persists after a few weeks, I'm going to refer you to a physical therapist.
Sounds good.
Okay?
Thank you.
Hello there, Mr. Funk. So my papers here show me that you have tennis elbow, is that correct?
Yeah, it's been hurting really bad.
Okay. Well, I'm going to show you 2 exercises that you can do with your elbow to work on its strength and endurance.
Okay.
First what I'm going to do is I want you to lean your elbow on your knee like this.
Alright.
And I want you to take the weight in your hand and I want you to just flex your wrist up and down like this.
Alright.
Okay. Good. Now the next one I want you to do, I want you to put your hand out like that, put your fingers together, and I'm going to put a rubber band around your fingers, and I just want you to open and close. Good. So do those exercises seem like something you'd be able to do at home?
Very doable.
Okay, good.
Hi, I'm Nurse Katie. How are you? What seems to be bothering you today?
Well, I got diagnosed by my doctor with tennis elbow, and none of my previous treatments have worked. I've done physical therapy, and I've also tried some over-the-counter NSAIDs, and
Okay.
now I'm here.
Alright, well, since none of the other treatments have worked, I'm going to give you a steroid injection of cortisone. So that will help decrease the inflammation and relieve the swelling of the muscles on the outside of your elbow.
Okay.
Alright.
Sounds good.
First, I'm going to mark the area on your elbow where there is tenderness so that I know where to give the injection. Next, I will clean the area with iodine and then alcohol, then spray on a local anesthetic so that you do not feel the needle. Now I am going to give you the injection. The cortisone should help relieve your symptoms. You may have more pain than normal for the first day or 2, so use ice to help with the pain. I can give you up to 3 injections in a year, but after that, the injections may cause harm and will not be effective. The next step would be surgery. Good luck with your elbow and let me know if you have any problems or questions.
Hi, Mr. Funk. You're here to get your surgery for your tennis elbow, right?
That's correct.
And it has been 6 months since your last steroid injection?
No improvement.
Alright, so today we are going to do an elbow arthroscopy, which uses much smaller incisions than open surgery, so you don't have to stay in the hospital overnight, and you will recover faster and have less stiffness in your elbow. We are going to give you a general anesthetic, so you will not be awake during the surgery.
Alright, sounds good.
Let's get you ready for surgery.
Let's do it.
First, we are going to fill the joint with fluid, and then we will insert the arthroscope in through a small incision, which will allow us to see inside the joint and then be able to find the problem. We can then use other small instruments to remove any diseased muscle and then reattach the healthy muscle back to the bone.
Your surgery went well. I want you to keep this brace on so you keep your elbow immobilized so you can heal up quickly.
Okay, sounds good. Thanks, doctor.
You're welcome.